At the moment, it's already a jam-packed field of those who have indicated interest in running to be governor of Anambra State in the southeast of Nigeria after the election in November. Each and every one eminently qualified in their different vocations. But the question is, what would ordinarily motivate a man that has spent more than $20 million in various community development projects in his hometown to want to seek office of governor in a state where, despite the existence of more billionaires per square kilometer than any other in Nigeria, community philanthropy remains a scarce commodity? We'll get to look at that now by linking up to our Abuja studio to speak with Godwin Maduka, a medical doctor and founder of the Las Vegas Pain Institute and Medical Center, a man who founded the construction of houses for the poor, churches, markets, schools, police station, police academy and college, post office, magistrate court, and a high court for the Anambra State government, as well as a 17-floor multiplex medical research center in his hometown, Umuchukwu. Welcome to the program. Good morning, sir.
Good morning to you. Thank you.
Morning, Dr. Maduka. It's good to have you again on the morning show. Well, very quickly, if you could just give us an update on your plans for the gubernatorial election in Anambra State on November 6th. If I'm correct, you belong to the PDP. Have you gone through the screening process?
Yes.
And, what do you intend to do for the people of Anambra State? You become the candidate of the PDP.
We just concluded. Yes. Thank you for the question. As you mentioned earlier, we just concluded the screening process, which went successfully. The question is, why come out for the governorship of Anambra State after doing all the philanthropic work that I've done in my home, Umuchukwu? I tell people it's humanity first. My entrance into the governorship race has nothing more to do than caring for the people, doing more for Anambra State than what I've done in my town. And so to make sure that every corner of Anambra State is taken care of, we'll move the state to a better level than where it is now, including infrastructure, education, healthcare, which you know that I'm part of, women and youth empowerment, religious tolerance, social welfare, transportation, air, land, and sea, and make sure that most of those are touched. And that's why I'm entering into the governorship race for Anambra State under PDP.
Well, you're clearly very proud of your philanthropic record, but how do you think that qualifies you for governance?
Well, philanthropy is part of governance. To enter the race, you really have to care about the people. It doesn't necessarily qualify me. That's not one of the qualifying factors. It's one of the qualifying factors, but that's not the only thing I'm bringing on board. I mean, the philanthropy is caring for the people, building homes for the people, sending children to schools abroad and home, bringing Nigeria to the next level instead of keep sitting in the same level. So what I think qualifies me for the governor of Anambra State is the empathy I have for the populace, is for caring for people around me, is being able to bring that state to the level it should be. And from what I have done overseas and home, I think that ought to qualify me for the race of governorship.
Right. What's your plan for housing development in Anambra State? Maybe if you get a chance to lead the state. And also, what will be your plan for the healthcare sector since you're a doctor?
Okay, you know, Nigeria have a problem with the brain drain of the doctors going outside this country. We also have medical tourism outside this country. Building the 17 floors has nothing more to do than making sure that this type of movement of our doctors to overseas and our patients from Nigeria to overseas, we're trying to bring it back. So as a medical doctor, a triple professor in US, I plan to make sure that we build the type of healthcare that is seen in India, seen in America, we are trained, and every other civilized nation. So my plan is to reverse the medical tourism. I will also get involved in teaching the doctors, training the nurses, lab technologies, dealing with oncology, cardiovascular diseases, most of the stuff that our people are not quite there yet. There will be expatriates coming down with me, whether from India or US, everywhere else, so that we make it possible for people to stay here in terms of the healthcare. Now, somebody mentioned something about housing. Housing is very important. I've done it in my locality. Make sure that there's no more thatch houses over there. There's no more homeless issues in my native town. We had to be able to make sure that individual communities, whether in Anambra or anywhere else, we have a situation where they can be housed instead of staying out. So housing is something that is important to me, and I don't think it's too hard to do. I've done it for hundreds of people and getting them inside the house to stay. And we just got to bring it to the board and discuss about it and make fund available for it. It's a question of priority. People should not be staying outside their home.
Well, on that note, Dr. Maduka, I would like to thank you very much for joining us, and we wish you all the best with your plans to become governor of Anambra State. Thank you very much for joining us.